Hey, hi everyone, I'm Jim Lim. Easy to remember name, right? And it means a lot in different languages. I was told that in Vietnam it means cute. Basically, I'm a sector lead for NCS for healthcare. The mandate is really to grow the healthcare sectors within Singapore as well as regionally. Okay, as a sector lead for healthcare, do you conscientiously take good care of your health? Quite a lazy person. I don't like to exercise a lot. Yeah, but well, everybody asks me the same question. You are in charge of healthcare, you need to be perfect health, right? That's what we all aim for. But unfortunately, due to work, I'm not always at having the best health. But I think what's more important is whether I am or I'm not in my best health, I always promote healthy living. Was saving lives, being a doctor, part of your dream? Saving life, yes, part of my dream. Right, being a doctor in my dream, but I know I can never fulfill this dream. Why? Because I cannot dissect animals. Right, so when you want to be a doctor, doing dissection is a must. Right, so I can never even touch the animal. You don't ask me to touch a frog. So I save life through other means, right? Technology to help the doctors. Right, the only thing that I can think of is maybe I can be a TCM. I don't know whether a Chinese sensei needs to do dissect or not. How were some of the healthcare projects capabilities you were impressed with that was delivered by NCS? What really impressed me is that NCS is not just a normal system integrator that built some kind of outpatient system, appointment systems, right? I also see that there is a robotic arms doing a pharmacy dispensary, right? And then there are some deals that we are ongoing, discussing from controlling the different lift, right? Ward management and also patient management. If there was a healthcare project that you wish for NCS to implement, what would that be? One thing that most healthcare system vendors are not doing much is for the long-term care. Right? Long-term care can mean elder care or maybe chronic disease care. So when I was in China, I do see that due to aging populations, right, people are actually trying to do a lot of home care services, right, where you actually have a lot of mobile healthcare devices that people can actually put at home and monitor the patients and the elderly. Right? So I would think that some of the systems can be brought into Singapore and do better in terms of long-term care services. What is your aspiration for NCS healthcare team 3 years down the road? So I would definitely want to be able to take NCS beyond just the public healthcare into private healthcare as well as the regional healthcare, so that we can kind of establish NCS together with Singapore as a regional healthcare system providers. Right, I think that will be one of my vision that I hope to bring NCS to. Name 3 technologies that will be game-changing for the healthcare sector in the next few years. AI is definitely one of the game-changing technology for healthcare. Healthcare professionals need to read through many of those CT scan, X-rays, right? And sometimes they may miss out. So AI is supposed to help to lighten their load in reading all those and analyzing those data and give them the accuracy itself. And of course, there are others such as robotics, right? So you probably read about the case in US recently, the COVID-19 patient. In US, they actually use a robotic arm to operate and to diagnose and to treat the patient. Right? That reduces the risk of the healthcare professional from getting infected. So I think that these are the technologies that can really help to save more lives without endangering the healthcare practitioners themselves. So the third technology I would say is 5G, right? So in order to do remote surgery, you need low latency. And that's where the 5G network actually provides the low latency for you to be able to do that. Right? In the normal Wi-Fi or 4G world, you probably don't have the latency to be able to conduct a successful remote surgery, because you need to have a millisecond kind of a response rate for remote surgery to work. Okay, so hopefully Chinese say 明天会更好. So hopefully we all have a better tomorrow, right? Especially in this crisis moment of COVID-19. And then moving forward, I hope that we all can help to contribute more to a better healthcare scene in Singapore and in the region. We heard that you could sing for 8 hours straight non-stop at a KTV. Yes, I can sing non-stop, provided that I have enough water to drink. 让我们的笑容充满着青春的骄傲，让我们期待明天会更好。